welcome to Medical Dialogues. I'm Dr. Bhumika. Let's look at today's top medical news. NSAIDs double internal bleeding risk in patients on anticoagulants. People who take an anticoagulant medication double their risk of an internal bleed if they take a type of painkiller called a non-steroidal anti-inflammatory drug such as ibuprofen, diclofenac or naproxen, according to research published in the European Heart Journal. The new study is the largest of its kind and shows that there is an increase in the risk of bleeding in the gut, brain, lungs and bladder. The research was carried out by a team from Aarhus University Hospital in Denmark. They used data from Danish nationwide registries on 51,794 people given anticoagulants to treat a blood clot between 2012 and 2022. The researchers found that the risk of a bleed was 2.09 times higher when people were taking on NSAIDs and a blood thinner, compared to those taking a blood thinner and no NSAID. The risk for ibuprofen was 1.79 times higher, for diclofenac the risk was 3.3 times higher, and for naproxen the risk was 4.1 times higher. Drink beer? Pay attention to your diet. Beer drinkers have lower quality diets, are less active and are more likely to smoke cigarettes than people who drink wine, liquor or a combination, according to a study presented at the liver meeting held by the American Association for the Study of Liver Diseases. Using a survey of nationally representative samples of more than 1900 US adults who reported current alcohol use, researchers compared the diet quality among people who consume beer only, wine only, liquor only or a combination of alcohol types, measuring self-reported eating habits against the Healthy Eating Index, a validated standardized tool based on dietary guidelines. None of the alcohol-using groups came close to achieving the 80-point score that is considered an adequate diet on the 100-point Healthy Eating Index, researchers said, but the beer drinkers scored lowest at 49. Wine drinkers scored 55 and both liquor-only drinkers and combination drinkers scored nearly 53. A diabetes drug may maintain kidney health. Type 2 diabetes can lead to diabetic kidney disease, but a class of drugs that cause the kidneys to remove glucose through urine has been gaining attention. An Osaka Metropolitan University-led research group has investigated how such drugs maintain kidney health. The findings were published in Frontiers in Endocrinology. Known as SGL2, that is sodium glucose cotransporter 2 inhibitors, the drugs are used to treat type 2 diabetes along with an exercise and diet regimen. The group, led by Graduate School of Medicine Associate Professor Katsuhito Mori, focused on the sodium glucose cotransporter 2 inhibitor conagliflozin and its effects on the kidney. Can marijuana exposure in womb lead to increased risk of addiction to opioids later in life? A new study finds that prenatal exposure to tetrahydrocannabinol, the main psychoactive ingredient in cannabis, causes a rewiring of the fetal brain, which could increase the risk of addiction to opioids later in life. The preclinical animal study, led by researchers at the University of Maryland School of Medicine, was published in the journal Science Advances. Tetrahydrocannabinol caused certain brain cells called dopamine neurons to respond in a hyperactive way, causing a heightened increase in dopamine release. This was accompanied by heightened neuronal responsiveness to cues associated with rewards like a light turning on to indicate that food or an opioid drug was available. The American College of Obstetricians and Gynecologists recommend that doctors counsel patients on concerns about potential adverse health consequences of continued use of cannabis during pregnancy. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.